Have you ever felt the feelings of bulge and heaviness and pressure down there, and then when you looked, you saw that there was a ball coming out through the vagina? This is known as pelvic organ prolapse, and it's more common than you think. While early stage prolapse can be managed with non-surgical treatment options, for more advanced stage prolapse, surgery is the way to go, and that's what we're going to be talking about today. Hi everyone, I'm Dr. Nabila Noor, board-certified and fellowship-trained urogynecologist and reconstructive surgeon, and in this channel, we talk about everything pelvic health, what to do about it, and when to seek help. If you like what you see, please subscribe and don't forget to share it with a friend. Pelvic organ prolapse happens when your pelvic organs, which could be the uterus, the bladder, the rectum, the intestines, are essentially pushing through the vaginal wall. And that's because of the weakness of the pelvic floor support structures. So our pelvic floor essentially forms the base of our torso, and it helps support these pelvic organs. Why does the pelvic floor muscles get weak? There are various different reasons for it, but the most common risk factors are age, menopause, pregnancy, childbirth-related trauma, chronic constipation, chronic cough, genetics, obesity. Any of those factors can cause those muscles to get weak, and as a result, we end up with a vaginal hernia, essentially prolapse. When we talk about prolapse surgeries, there are various ways we can do these surgeries. Some surgeries we do vaginally, some surgeries we do abdominally, some surgeries involves doing a hysterectomy, which is removing your uterus. Some surgeries can be done without a hysterectomy. Some surgery uses mesh, while others do not. Now, there are lots of factors that we take into consideration when deciding what surgery is appropriate for the patient. Things like patient's lifestyle, how significant their prolapse is, how many areas are prolapsing, whether or not they plan to be sexually active after. All these factors can help your surgeon determine what surgery may be the best option for you. To make it more easy to understand, I will break my discussion into two different categories of repairs. Number one are all the vaginal repairs, and number two are all the abdominal repairs. So let's start with the vaginal repairs first. The most common types of vaginal repair that we do for prolapse are things called anterior repair or a posterior repair. So anterior repair is for patients who have something called an anterior wall prolapse, or commonly known as cystocele, where the bladder is pushing through the vagina. And a posterior wall repair is for a posterior wall prolapse, or commonly known as a rectocele, where the rectum is pushing through the vaginal wall. These surgeries are done through the vagina, where we make an incision into the vaginal wall. We identify the tissue that likely got disrupted, causing these prolapse. We reinforce that area, we tighten the vaginal walls, and that's it. They're simple procedures, usually takes about 30 to 40 minutes. We can often do them with sedation. Patients go home the same day. Now, when the uterus is coming down, there are some vaginal repairs that we do, and these are known as uterosacral ligament suspension or a sacrospinous ligament suspension, as well as an iliococcygeus ligament suspension. Don't worry about the name so much because they can be complicated, but remember that there are options available. Now, some of these surgeries may involve doing a vaginal hysterectomy and others may not, and why one should get a hysterectomy versus not, why one should have their ovaries removed versus not. These are very nuanced discussions to have with your surgeon. A hysterectomy is not a requirement to fix your prolapse because, again, the uterus is not the problem. The reason the uterus prolapses is not because of the weight of the uterus, so it doesn't matter how big your uterus is. It's because the support structures that should be holding the uterus in its place inside your abdomen is not working the right way. So when we're trying to fix prolapse, you really have to fix that support structure and not just take out the uterus. There are other reasons why your surgeon may recommend a hysterectomy at the time of prolapse repair, because maybe you have had other pathologies, such as abnormalities in your uterine lining. Maybe you have some fibroids. Maybe you're suffering from abnormal bleeding or had an abnormal pap smear. So again, these are discussions to have with your surgeon about whether or not you should consider a hysterectomy at the time of your prolapse repair. Next, let's talk about abdominal procedure. Now, when I talk about procedures abdominally, traditionally we used to do a big incision, kind of like a C-section incision, where we made a huge laparotomy, meaning a big cut to do these repairs. But now we can do most of these abdominal surgeries using a minimally invasive technique. So for me, for example, when I do these surgeries, I use the robot. So my patients have tiny incisions on their abdomen, which are each less than a centimeter long. As a result, my patients are going home the same day. Their blood loss is minimal. Their pain after surgery is minimal. They're waking up feeling really good. They're going home the same day. They're recovering much faster. So the overall recovery is very similar to when patients are getting these surgeries done vaginally. The most common abdominal surgical repair we do for prolapse is something called a sacrocolpopexy, where essentially we attach a piece of mesh to the vaginal walls and use that mesh to suspend the vaginal walls, and then the tail of the mesh we attach to a ligament right above your sacrum. The reason to use the mesh is because the mesh is a permanent material. It doesn't age with your body. It doesn't deteriorate with your body. So for more advanced stage prolapse, this is a preferred approach because the long-term success rates are much better than, say, if you just did the repair using your own tissue. A lot of the times patients are concerned about the use of mesh, and yes, there were some controversies about mesh, but I'll make a separate video about that. But at least know that for the right patient, this surgery can be a total game changer because it's one of the most successful surgeries that we have because the long-term success rates are amazing. Similar to the vaginal procedures that we do when the uterus is dropping, sometimes we do the sacrocolpopexy with a hysterectomy, sometimes we don't. And again, whether or not to consider a hysterectomy is a discussion to have with your surgeon for your specific case. Finally, I'll talk about a very special kind of procedure that is reserved for a very special group of patients. This procedure is known as colpochliesis. So it's kind of an obliterative procedure, whereas all the other procedures that I described before are more reconstructive. What that means is that this procedure is not for women who want to be sexually active, because what we are doing with the surgery is we're closing the vaginal canal so the pelvic organs cannot push through. So when you close the vaginal canal, these patients cannot have any more vaginal penetration and so cannot have sex. So it may sound like an awful surgery, but to be honest, for the right patient, it can be amazing. I have many patients who are much older who may not be able to tolerate a major abdominal surgery, or maybe they have other health conditions because of which they cannot tolerate a different kind of surgery. This surgery is very quick, very simple. It's all done through the vagina. Again, a lot of the times we can do it with some sedation. So for the right patient, this surgery is a total game changer. So there you go, a quick overview of the different kinds of surgical options we have for patients suffering with pelvic organ prolapse. Again, I didn't go into the details of the surgery because a lot of that is discussions to be had with your surgeon. But what I would urge you all is, if you are somebody who's looking to have surgery for prolapse, the first thing you need to do is do your research, find the right surgeon, find the right specialist with the right training and the right background, as well as the right experience, who do these surgeries very commonly, who have a lot of experience doing them, so that they can talk to you about the various different options based on what your exam looks like, what's your specific prolapse, and then come up with a plan that works best for your quality of life. Hope you found this video helpful, and click the notification button so you can be alerted when the next video comes out. Hope to see you soon. Bye.